Dear friends, I am Dr. Prashant Pawar, Consultant Cardiologist, Fortis Hiranandani Hospital, Vashi. Today I will be speaking about causes of hypertension. Hypertension is defined when the blood pressure is more than 130 by 80 mm mercury. Earlier definition was elevation of blood pressure more than 140 by 90, but it was found that even at BP more than 130 by 80, serious effects were found. Hypertension is very important because 30% of Indian adults and 4% of school children they have elevated blood pressure. Commonest causes of blood pressure are: one is age. As age advances, the artery becomes stiff, and that is the most common cause of hypertension. Second is women. After menopause, there occurs a lot of hormonal changes which gives rise to elevated blood pressure. Genetics. Patients who have their father mother having hypertension and first degree relatives with hypertension, they have a high incidence rate of elevated blood pressures. So they should be evaluated regularly by health checkups so as to diagnose hypertension at an early age. Fourth comes the lifestyle changes. Lot of smoking, excessive alcohol, lot of stress and lack of physical exercise all leads to obesity and elevated blood pressure. Next is the kidney diseases. Patients who have underlying kidney disease, they have elevated blood pressure. Endocrine diseases like thyroid disease, adrenal disease, they secrete a lot of hormones which causes elevated blood pressure. So in India, we are seeing nowadays youngsters with obesity, and most of our school children, they are also having increased incidence rate of obesity. Causes are a lot of junk foods, lack of physical exercise, lot of fat intakes, fried foods, which give rise to obesity and in turn causes elevated blood pressure. 4% of school going children, they have elevated blood pressure. So if you find a patient with elevated blood pressure, he has to get evaluated by a cardiologist and to get his kidneys and endocrine organs evaluated, because mere elevation of blood pressure, it's not a disease. Sometimes it can be a symptom because of underlying problem, and if you control the underlying problem, the BP gets controlled. So the take home message from my talk is, whenever you have elevated blood pressure, first is you have to have regular exercise, be on a healthy lifestyle, reduce the fat, reduce the salt intake. Salt intake should be between 2 to 5 gram per day. Third is to do daily exercise, almost 30 minutes of brisk walking or at least 4 to 5 kilometers of walking so as to control your weight is important. Then comes the medications. So you have to be compliant with the medications. Thank you.